Thank you very much, Angela. So, how will we state that in front of our doctors so that they would believe us? You have to begin with, you have to begin by making sure you have, you can, tawag nito, project na alam at kilala nyo ang gamot. Okay? Cholestyramine is in powder form. Yes or no? Everyone? Yes. So, it is inappropriate to take cholestyramine in a powder form because it will choke our patient. And according to the instructions in the drug literature for cholestyramine, it has to be admixed with or mixed with or dissolved with liquids such as water or maybe juice. So, you get now what's the difference between logic and science? You need an evidence. Why? So, you have to explain to the doctor. Class, ha? You have to explain why your answer is letter B. Because practically, how will your patient take a powder form drug? Okay? Okay, thank you. Let's proceed with number 3. Any takers for this? Nanganak na si KB. Pagkapanganak ni KB, anong tanong dyan? KB decides she would like to breastfeed her baby. What is the most appropriate recommendation to make? Anyone? The first one is Joanna. Sige, Joanna.
Ay, good afternoon po, Doc. For, in my opinion, sa akin lang po, Doc, is letter C, continue therapy with cholestyramine since kapanganak niya lang po and it is safest to her baby also.
Okay. So, if it's the safest, how about niacin? Is it a good, is it safe or not?
Um, na, I think not, Doc, because it can cause flushing since it is a baby and not well developed pa yung mga organs niya po
Okay.
due to the presence of prostaglandins of niacin. Ay, sorry.
How about, is niacin good enough as as the drug to manage LDL? It's no. 'Di ba? Reinitiate statin? No. Give cholesterol? No. Icosapent also is for triglyceride. High triglyceride. So, this is the answer. Okay? Thank you, Joanna. Next, we have another case. Ayan. So, case here with the first question. And I want you to do the process. How did I do it on the case 1? I will just wait for a raise of hand. I'll give you 2 minutes. 2 minutes or less. Meron na? Merong gustong mag-answer? This is, sige, I will underline. 54-year-old male. Most of the time in our lecture, higher risk si male. So, ang haba ng case, you can read, no? During my exam sa PEBC, sometimes, do practice pa lang, practice. Sometimes, umuuna talaga ako sa question. I don't know if it's sound, but it helps me navigate a long case and make me analyze it, what are the things that I am or I should look for. So that is one strategy. Okay? You please remember that. Example, if you take an exam or if you are in the ward, no, if you are in the ward and then there's a doctor, try to know first the concern. Okay? So that you have an idea what to explain. So sometimes meron tayong also ka ng tawag nito, yung face to face nga na encounter with doctors. I always remind myself, less talk, less mistake. Because ang daming pwedeng i-explain, baka hindi mo mapanindigan, no? So less talk, less mistake. So you have just to know ano yung concern, what's the matter on hand. Which of his prescription is most likely to contribute to hyperlipidemia? Okay. So, class, kung basahin niyo yung question na to, itong question na to, kahit pa hindi niyo basahin yung case sa taas, dapat meron kayong sagot. At dapat tama yung magiging sagot ninyo. Kasi, it's a basic knowledge for pharmacists to know what drugs may cause hyperlipidemia. So, I am wondering, wala pang nagre-raise ng hand ngayon. Christian. My Christian. Okay.
Letter C, Doc.
Letter C, which is
Risperidone.
risperidone. Why is it causing hyperlipidemia, Christian? How did you arrive to that answer?
Kasi po, ito po, ang risperidone po, antipsychotic. Tapos yung known side effects po talaga ng antipsychotics is weight gain. So, kakontribute po talaga ito sa hyperlipidemia.
Thank you. Very good. It's a first generation antipsychotic. Yeah, it's notorious. Antipsychotics generally is notorious for weight gain. Okay? So, if you don't know about risperidone, other students there, listen, if you don't know and specifics about risperidone, you have to find a way to eliminate. Like, have you heard about ramipril causing hyperlipidemia? Parang it's not heard at all. How about allopurinol? Much more of acetaminophen. So, definitely the best answer is risperidone. If you do not know about risperidone. But if you knew, then when I show the case now in 2 to 10 seconds, you would answer C. Okay? And kung sa actual na setting, class, no, kung sa actual na setting, mahirap pag naglalag tayo kasi may, alam niyo yung parang may mga tumutunog na kruk 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 kruk. Parang ano yon, yung awkward silence between you and the doctor kasi ang tagal lumabas ng sagot sa mind, no? Ang tagal. Parang natatawa sila sa akin dito. Yan, tumasa yung energy ko. Ang tagal lumabas ng idea. Risperidone yung answer. Okay? Next question. Same case. Oh my God, ang tagal din. Ano na? Anyone? Kasasabi ko lang to kanina. Shaira.
Letter A, Doc, hypertension.
Letter A, hypertension. Thank you. Okay? See, ngayon tumatawa kayo kasi alam nyo, pero logic yun, alam nyo, logic lang yon. Wala kayong evidence. Tandaan nyo, sinabi ko na kanina, CHAD 65, Framingham score, risk score. So, I hope yun yung basis ni Shaira when she answered A, hypertension. Okay? See? Third question. Yung iba, nauubusan na ng tanong. Pahirap na ng pahirap to. Answer number 3. Anyone? Mr. TC is prescribed simvastatin 10 milligram every night. What should be his drug therapy target? Sige, class, wag nyo akong tingnan o yung module or yung screen. I-open nyo yung module ninyo sa dyslipidemia. Tingnan nyo kung anong pwede nyo isagot dito. Yes, Mary Mill.
I think Doc, letter A according to the Philippine international guidelines.
What does it says?
LDL-C less than 2.0 millimole per liter
For what?
is the target therapy.
Okay, for what category, for what type or classification, risk classification?
Primary prevention and
Okay, primary prevention.
as
Okay. Letter A. That is correct. Okay? So, remember, when we discuss FRS, and then, di ba, we have cut off. Ang na-mention doon, si LDLC, si ApoB, and triglycerides ba yun? Okay. They have different cut-offs, right? For intermediate risk, for high risk. Okay, so we will not talk about low risk kasi nandun siya either intermediate and high risk. Alright. So, ang ating patient ay dapat merong cut-off na less than 2.0. Ang IR, independent, ang ating intermediate risk, our LDL should be less than 2.5. For high risk, should be less than 2.0. For ASVD, it should be less than 1.8. So, walang sagot dyan. Walang option dito na ganito. 'Di ba? So, most probably, hindi ito kasi that is the value for same thing as above. Ito siya. Pwedeng ito, pero this is very conservative or very low for patient not yet in ASCVD. Remember ASCVD? So it's too strict, no, for this kind of patient. pwede pang higher than 1.6. And not this one. Okay? So, we have to write here, Mary Mill. Thank you, Mary Mill. Same case, question number 4. Do not mind the M here. Anong answer natin? Ano yung counseling points na gusto niyo ibigay or malaman, ma-review about simvastatin? Lionel.
Ma'am, try lang po. Ano ma'am, dapat take at night. Siguro ma'am yung letter B.
Letter?
B ma'am.
Boy.
Because ma'am, di ba pag gabi, ang cholesterol natin is mas napoproduce. Parang yun yung peak ano niya ma'am, di ba? Tapos, avoid siya ng grape juice dahil may drug interaction siya. Tapos, based dun sa niya, sinabi niya, hindi siya nag-exercise. So, pwedeng encourage siya ng exercise tsaka dietary changes.
Okay, thank you for that convincing answer.
Tama
That's
ba, ma'am?
correct. Yes, that is correct. That is correct. Letter A and
Thank you,
B can be a little confusing, but if you see, it's avoid orange juice. We haven't listed that in our drug interaction, no? So, it's wrong. Definitely panggulo lang siya. Then, this is given already. Okay? So, letter B. Take at night, since that's the peak of our cholesterol synthesis. Avoid grapefruit juice. And encourage dietary changes and lifestyle. Alright, we're down to the last 2 cases, I think. I don't. Sige, ito, another case. Basahin nyo muna yung case. Kasi later on, sabay-sabay yung 4 na question. So, sunod-sunod yun na mag-answer later on. Basahin nyo muna. Meron ng idea, nabasa na lahat. Sige. Let's have a question. Sige, paunahan kayo. Number 1. Sino na gusto number 1, number 2, number 3, and 4? Sagot kayo, baka antok kayo eh. Number 1. Which of the following is a major risk factor for ACS in this patient? Tikan ko ha. Female ba siya? May diabetes ba siya? Nagsisigarilyo ba siya? Umiinom ba siya? Or meron siyang chronic back pain? Major risk factor. Hana.
It would be letter B, Doc, type 2 DM.
That's correct. Very good. Thank you, Hannah. Class, what take it so long? Diabetes, oh. Okay? Number 2. John Mark. Magbibilang na sana ako. What's your answer, John Mark? Diyan, nawala si John Mark.
Oh, letter B po. Di ba lang ako ano?
Letter B. Okay, letter B is correct. Okay, if you can remember ACS, sige, answer muna kayo para walang Number 3. 1, 2, 3. Class, number 3. So simple.
Doc.
Louis.
Indefinite, Doc.
Okay.
Letter E.
Question pa talaga. Indefinitely, Doc.
Indefinite. Yes, letter E, Doc.
Dapat convincing. Aspirin should be taken indefinitely, Doc. Oh, dapat ganun ang punto, ha? Kasi yun
Sige po,
yung
Doc.
nasa guideline pa. Ulit ko sinabi sa lecture yan. Thank you, Louie. Number 4. Yes, Rika.
NSAIDs, Doc.
NSAIDs, correct. Okay. So, you see, this is very practical. Thank you, Rika. These are very practical questions here. And it takes time to answer. I know you know the answer, but a little bit scared to say it. Now, it's just me and your classmates. So, how much more if you are already deployed in the hospitals? So, you have to gain mastery of the topic so that you'll be confident to answer. Kasi hindi ko yan siya ma-achieve para sa inyo. Okay? I can just remind you to gain mastery so that you can deliver it with confidence. So, if you can remember sa number 2, I was about to say kanina, sa ACS. 'Di ba? Sa ating algorithm doon, we have acute management. This is immediate upon suspicion. There is acute and the mainstay. The acute, we have nitroglycerin, either spray or sublingual. Okay? If you have this, we can give 3 doses every 5 minutes. No? Every 5 minutes. When you give the first dose, call 911 and give the next succeeding doses. Whatever the outcome is, patient should be brought to ED. Kung na-relieve or hindi na-relieve, patient should be brought to the ED. Okay? Next case. And this is question number 1. Sirit. Anong answer sa number 1? Merong diyang nakalagay. There was no relief in his chest pain. Daniel.
Try ko lang ma'am. NSTEMI po. Kasi depress yung ST segment niya.
Meron tayong, asan yun? Dito, ST depression. Okay, and STEMI. Why not unstable angina? You have missed one thing. I'll give you a chance, Danielle. You have missed
I
one.
think yung troponin po niya, ma'am, wala po nag-increase. Kaya
Okay.
unstable.
So, wala nag-increase.
Yes po.
The
Sorry
answer
po.
is unstable angina. That's correct. Very good, answeran. Do you agree with the answer? Unstable angina? There are 3 given here. There was no relief of no relief for chest pain after giving nitroglycerin. So, at first una may isip mo na stable angina siguro to kasi nag-ano siya ng mga snow, 'di ba? Pero pag stable angina siya, ma-relieve siya ng nitroglycerin. Ngayon, hindi siya na-relieve. So, dinala siya sa ED. Pagkakita, nag-depressed. Baka nga unstable angina or NSTEMI, no? But ito ang given natin. 0 troponin normal. So, it's not MI. It's just chest pain. Unstable angina. Number 2. Yes, I know. Next again. Another one pala. Next time ulit. Renal. Pag ano. Number 2. Whoever did not participated yet, please answer. This is very simple. Which the following is not Hana. Tapos na ba si Hana? Tapos ka na, Hana, di ba? Hasan.
Letter D, ma'am.
Why is it
D.
letter D?
It's a physical activity.
Why is not a risk factor?
Because age and gender and diabetes are risk factors.
Okay, that's how you get it.
Yes, ma'am.
This gender is also a risk factor, so it's D. Correct. Thank you, Hassan. Number 3. Number 3. All the following should be administered to QB immediately except. There's 2 keywords here. Immediately and except. Diba? Ako sasagot nito. Carl. Okay, thank you. Carl, what's your answer? Carl, unmute yourself.
Sorry po, Doc. Letter D po, Prasogel 10 mg daily.
Okay, why is it the one exempted?
Because ano po, hindi po siya binibigay immediately only if known na po yung sa patient po, yung acute coronary syndrome.
Okay, that's correct. Remember, thank you, Carl. Remember, when we have ACS, ito si stable angina, iba ang kanyang package, di ba? Kumbaga yung kanyang yung kanyang treatment, kumbaga iba yung kanyang branch. Itong tatlo dito, MI, and unstable angina, meron silang acute treatment, no? May iba't ibang acute treatment. These are all under acute treatment. This is not. This is after you have stabilized the patient, and it's not Prasogel, Prasogrel that is given most of the time. Our DAPT, dual antiplatelet therapy, is with ASA indefinitely plus Clopi or Tika Grelor for 1 year max. Okay, so that is the answer, the least not ibigay. Okay? It should not be in the immediate or acute care. Number 4. Which of the following is not an initial treatment option for QB? If I can remember, this is ACS, this is NSTEMI, PCI. Walang sasagot? Ay, Don. Unmute yourself.
Hello, ma'am. My answer is letter 3, thrombolysis.
Okay, very good. Thrombolysis. It's not an initial. Malapit na sana akong matapos magsulat. Thank you. Okay. Last question on this case. Ay, sorry. On discharge, which of the following medications should be given to QB? Come on. On discharge, which of the following medications should be given to QB? Okay, walang sasagot? Sirit? Tapos na si
Try
Abu
lang, ma'am.
Marwan, pero sige, try. Kasi walang mag-raise hand. Sige, what is your answer?
Asa po. Letter D.
Letter D, asa? Why asa?
Since unresponsive po siya sa nitroglycerin.
Asa is not the correct answer. Nice try. Let's have Shaira. Ay, sino yun? Shaira? Shaira ba? Unmute yourself.
Yes, Doc. Letter C, Doc, bisoprolol. 5 milligrams orally daily.
Why bisoprolol?
Kasi po, Doc, beta blocker siya, tapos pwede siyang gamitin for ACS, including may mga unstable angina.
Okay. I will not answer yet. Sino yung raise hand or nagsagot ito sa chat? Si Don. Why pravastatin, Don?
Because the patient, ma'am, is already a high risk of arteriosclerotic cardiovascular disease.
Okay, that is noted. Sige. How about Miramil? Okay, later on na. Incorrect dose AC. Okay, let's try to answer. On discharge, which of the following medication should be given to QB? Okay, for letter A, this is the only thing that we know about QB, right? This. Balikan natin si dyslipidemia. What are the premises that a doctor will prescribe statin? First is presence of lipid that is high. Right? We have 3 things to check. Lipid, LDL, LDLC, non-LDL, and ApoB, or if we can have triglyceride. Do we have that? Do we have these results in our patient? Meron, wala? I think wala. Wala. So, wrong. Kung meron, pwede tayong. Kung meron, pwede tama ito. Pero wala kayong data. So, hindi siya ibigay. You get it? It's case-to-case basis. Based sa case natin, walang data. So, there's no indication. Do not give. Letter B, diltiazem. Diltiazem. Anong mali dito sa diltiazem? Diltiazem. Teka lang, class kayo. Sige, anong mali dito sa ating diltiazem? Not first line, correct? And also, so high. Para saan ba yung diltiazem? Para sa chest pain, pwede. Binibigay siya because it's an AV nodal blocker. Diba? Diltiazem and verapamil. Okay? But most of the time, it's a mainstay for AFib, not for angina. Remember AFib? Most of the time, sa AFib siya mainstay, not for angina. But there's no mention of AFib. Bisoprolol and ASA. So it's a given already. This is wrong. This is not the dose, for lowering CV risk. What is the dose for lowering CV cardioembolic stroke? It's 81 milligram. This one is actually my son had a condition last year. Good thing it was corrected already. He has to take 6 tabs aspirin 80 milligram times Q8 for heart murmurs due to rheumatic fever. So, tandaan nyo, this is additional knowledge, ha? Aspirin with this very high dose allows, aspirin with very high dose protects the patient with rheumatic fever not to proceed to rheumatic heart disease. And this very high dose prevents thromboembolic events that will cause fluctuations in the heart and of course cardiac arrest to anyone with this condition, either it's children or adult. So this is wrong. This is the correct one. Please take note. Ang daming nangyari sa slide natin. Ang daming nasulat. Bisoprolol 5 mg daily is the correct answer. Any question on this case? Wala. Okay. Case number 2. This case, please check and look at the question. No answer yet? Uy, yun. What's this? Sino yun? Joanna.
Try lang po, Doc. Letter D, clopidogrel 5 days before CABG.
Okay, very good. Why? Because it will increase what?
Bleeding, Doc.
Okay, very good. Thank you. Okay, next question. tingnan nyo ang indication for anginal symptoms. Alin dyan nag-work for anginal symptoms? Should be 5 minutes to answer that one. Mark. Adja, I know, Louis. Sorry, Louis.
Doc, letter A, atenolol.
Okay. Atenolol. This one is for thromboembolic events, letter B. Right? To avoid risk of stroke. Correct? Letter C, this is for terasusin. Is it for anginal symptoms? Definitely not. And hydrochlorothiazide is for hypertension, diuretic. Okay. This one has no case, but I want you to answer this. Number 1, number 2, number 3. Number 1, first. Which of the following is not a risk factor for stroke? Ariel.
C po.
C. Very good. Thank you. Number 2. Don? Unmute yourself.
E, ma'am, no change needed.
No change needed. Which medication should be added or adjusted to better control this patient? Not really the best answer. Thank you, Don. Lionel?
Ma'am, letter B. Add, thiazides diuretics.
Okay, add hydrochlorothiazide. To better control, meaning you need to have dual therapy for hypertension. Number 3. Number 3, Shaira? Okay, later on. Finally.
Try lang po, Doc. B po. Acetylsalicylic acid.
Okay, very good. Which antiplatelet medication would be recommended for long-term secondary prevention of stroke? Acetylsalicylic acid. Okay, another set of case. This one. I'll give you 1 minute for this. What's our answer? Answer na. Sige, basahin ko yung case tapos try to answer, class, ha. 64-year-old man. Today is presenting to the ED. SJ's wife noted acute onset of slurred speech. O yan. Pag may ganito, slurred speech, dapat may bell na naman sa mind ninyo. Okay, ito yung stroke and TIA module. Tama? Saan ba siya related sa ating ibang hypertension asymptomatic, AFib, palpitations, dyslipidemia asymptomatic, acute coronary syndrome, chest pain. O pasok siya sa stroke and TIA, slurred speech. Okay. Stroke, TIA, buksan nyo ang module sa utak. Kung anong nakasave sa utak ninyo ngayon. Left-sided weakness, 35 minutes ago. Take note of this because it's needed for time to treatment. Okay, Hannah, what's your answer? Hannah, unmute yourself.
Yung letter D po, Doc, yung alteplase na 0.9 milligrams per kg.
Okay.
Kasi yun po yung nasa within 4.5 hours pa po yung time frame nung nagkaroon na siya ng symptoms po.
Okay, sige. Let's Continue, okay? Okay lang. She called EMS for transport to the nearest hospital as she has past medical history of dyslipidemia, gout, diabetes. So, dyslipidemia, diabetes, takes Rusu and metformin, no allergies to medication. Who wants to say something? Subaida. What's your answer, Subaida?
Letter D po kasi kailangan po muna ng brain imaging para i-differentiate po if ischemic or hemorrhagic stroke.
Anong letter yun? Answer mo?
Letter D po, none of the above.
Letter E yan siya.
Ay, letter E, sorry ma'am.
Letter E, none of the above. Okay. Okay, so we have for stroke, IS and HS. How will you differentiate it? Using CT scan. TPA is not allowed here, is allowed here. Do you agree, everyone? Is it what you heard in the lecture? TPA is allowed for ischemic stroke and not allowed for hemorrhagic stroke. So, the correct answer for this case is letter E, none of the above. We have to do brain imaging first if it's ischemic or hemorrhagic. If it's not hemorrhagic, then the answer a while ago is correct to give TPA. Okay, altiplase with the correct dose. Thank you, Subaida. Number 2. Okay, what are the all of these are absolute or relative contraindications for TPA, but except for yes, Timothy. Let's unmute yourself.
My answer is INR's secondary to 1.6 secondary to warfarin
Yes, why is it your answer?
because it is below the threshold for TPA contraindication.
What is the threshold that is contraindicated?
Above 1.6, above 1.7.
Above 1.7. Is that in the module?
I think so.
Letter B is correct. Thank you, Timothy. So, all of these are contraindicated. If we were going to give a TPA, you have to consider if the patient has thrombocytopenia, mababa ang platelet, you cannot give TPA. The BP is too high, you cannot give TPA. The blood glucose is this level also. And the current use of the OAC, you have to bridge pa. So, except this one because the threshold as mentioned is more than 1.7. Okay? Next, number 3. What therapy should be initiated prior to SJ leaving hospital, assuming a diagnosis of ischemic, non-embolic stroke, and elevated blood pressure? Oh, class, 5 seconds. There's a keyword there. Kevin.
Try lang doc yung B, perindopril plus indapamide.
So, what's your keyword there?
Yung yung pril, ma'am, kasi kuhan. Tawag nito?
Ganyan ka sumagot sa doktor. Hindi ka na paakyat sa ward.
Guess lang ba yun, ma'am? Sorry.
The keyword is this one, elevated blood pressure. There's another keyword, ischemic non-embolic stroke. What should be given as part of the discharge medication? Metoprolol is not first line for non-embolic and hypertension. It's wrong. Amlodipine is not the first line also for hypertension. The patient did not receive any hypertensive medication prior to this condition, to this admission. So, wala pa siya nare-receive kahit isa. So, amlodipine is not the first line for hypertension. Dabigatran. Ma'am, di ba si dabigatran, Dre, remember, is for mga embolism, no? Di ba? It is in your module. This is for cardio embolic events. Ha? Tandaan nyo yan. Kunti lang masyado yung word na mag-iiba. Non-cardio embolic events. Ano ang ibibigay? Your ASA, your PGY12 inhibitor, yun sila, yung dual antiplatelet therapy. So, the bigatran is wrong. Nitroglycerin, bakit siya bibigyan? Walang chest pain, tapos pauwi na. No? So, definitely not. Letter B, correct. Thank you, Kevin, for your guess. But next time, you work out with that logic and evidence, ha? When you speak it, has to be delivered professionally. Okay? Pwede pa? Isa pa? Meron pa. Which of the following is not a risk for ischemic stroke? 1, 2, 3, 4, 5. Sirit. Very simple. Which is not a risk factor? Okay, Ariel, Angela. What's your answer? Letter D. Wala akong isulat dyan. Very simple. This is a risk factor for hemorrhagic stroke. That is why you have to be mindful to put a label in our patient's door, patient's chart, if the patient is an elderly with anemia, with long-standing hypertension, dyslipidemia, and among all the complications, we have to label it risk for fall. Because any events that the patient might fall, tip off, something like that, it may cause trauma. It might lead to hemorrhagic stroke. No? Konting bagok, something like that. Alright, and last one for our case study. What should be SJ's target BP to prevent cerebrovascular accident? Para walang mangyaring stroke. Ano yung ating target BP? See? That's the first module and the last module. Hypertension and stroke. Dun, dun, dun. Dun, dun, dun. Anyone? Angela.
Kuan, ma'am. Letter A, less than 140/90.
Less than 140/90. Hapit na. Angelo. Ano ba
Less
yan?
than 130/80
Angela,
po.
Angelo. Okay, Angelo.
Less than 130/80, Doc. Letter B.
Okay. That's correct. Very good. Also, those who answered in the chat box. Correct. So, a little bit short, Angela, but we are there. This is our keyword. Right? If the patient is with diabetes, generally, our cutoff is less than 130 over less than 80. Okay? Alright, that's it. Did you had fun, class? Na-stress kami, ma'am. So, I hope with the exercise that we have this morning, this afternoon, you'll be able to carry